serratus. That's the delineation between the glandular and the non-glandular portion of the stomach. So that bright pink area is normal. Good job, big guy. Good job holding the feet off. All right, let's go in a little bit, Tori. So you can already see some ulcerations right along the lesser curvature here.
Okay.
Okay, those are active. Nice. Keep going, Tori.
Is that green stuff hay stuff
That's
from,
hay,
from
yep,
yesterday?
exactly.
Okay.
And then there's some more ulcers there. We'll come back and look at the Margot. We just always look at the there we go, exit. Perfect. And that's why right there. So this is the exit. This is the pylorus. See all that irritation right there?
That's all the red stuff
Yep,
there?
yep.
Yeah.
That's all. It's like grade 3 pyloric ulceration. Just going just a little bit more, Tori.
3 out of 5?
3 out of, yeah, 6 is perforated, which we never really see, but yes.
Wow.
There you go, right there. Beautiful shot. Yeah, really nice shot, Tori. So these are, see all these ulcers? Those are pretty good ulcers, yeah.
Okay.
And these are actually the harder ones to heal. Because what happens is it's the part where the feed's constantly abrading at the exit of the stomach. So we're just going to rinse him off.
So it was painful for him to eat, which is why he went off of food.
Exactly. And that really fits with the history that you're describing too. You can see how much, and the blood changes too, actually. Because what happens is every time he eats, he's getting an abrasion there and getting like a mild septicemia from the translocation of the bacteria in the gut.
And that would make the white blood count dip.
Could, yep, it could.
Okay.
Yeah, it could go either way, honestly.
Okay.
Let's go just a little bit more. A little more. Right there. Perfect. Beautiful. Nice. I just want to see on there. See when I'm washing it, there's no mucus coverage really. Like there's a little bit there. You can see a little bit of mucus there. And like covering there. Sorry, it just gets a little bubbly down here. See how there's a little bit of mucus there?
Yeah.
Here, there's nothing.
Nothing.
So it's just raw, basically. So he's not
okay.
getting any kind of mucus protection there. Yeah. So these are really the harder ones to heal, okay? Only about 80% of them will heal with just 30 days of Gastrogard for a tube.
Alrighty.
My recommendation, 30 days. No, 80%.
80%
will heal
30
in 30 days.
Got it, okay.
My recommendation is to re-scope at the 30-day mark after you've been on it for 30 days to make sure they're healed, because otherwise you just throw your money away because they'll come right back.
Okay.
And Merck's been pretty good lately that if they're not healed within 30 days, most of the time, if you have a pre and a post scope, they will help pay for parts of the additional to get them to heal.
So this is actually even on 2 weeks of ulcer guard, so they must have really been.
Yeah, right.
Okay.
Exactly.
All right.
Let's back up a little bit, Tori. So we'll go back and look at the Margot and complete the rest of that exam. But yeah, that was a good call by Dr. Steer.
And if, what about like preventative? Is there any way to, or is he just always going to be
So there'll be some things like the Gastrogard, and then Eguacin SDH has been really helpful for me in the past too, to help control them. There's just some probiotics and stuff that can be really helpful.
Have you ever heard of a Purina Outlast?
Yeah, Outlast is great.
Is that great?
Yeah, that's pretty good. I've
for that reason,
for that
just
reason,
sort of helpful.
Yeah.
Another.
It won't heal them,
right?
Okay, but I have had luck with preventing them that way.
Okay.
So
I bought a bag, so just whatever
sorry.
I can.
Yeah. So again, there's some ulcers here too.
And you can't tell how long he's had them, can you?
I can't. No.
Okay.
I mean, so see the cobblestoney look?
Yeah.
That doesn't happen overnight. That's more of a chronic irritation.
Okay.
Okay, it's back a little more. So I mean, for several months probably.
Okay.
But as far as what degree or severity, it's hard to say based on just today's exam.
Okay.
Sorry. I wish we could know. Good boy, bub. We're just cleaning off that Margot, exploring the rest of it here. Make sure we're not missing much. There we go. Okay.